patients across Greater Manchester. So I'm going to hand over to our chair, who will say a few words. We've posted the running order in the chat box. The whole plan is we hear a couple of patient stories, then we will get into breakout rooms. We'll also be hearing from Katie, who has kindly offered to come along, do lots of listening, as she also reaffirmed their commitment. We've had some conversations, discussion, but I think we will have colleagues also from Manchester Foundation Trust, probably Peter Blythen, and I think Stuart is on the call already, and a couple of others who, so yes, as many of you know, we have an acute and a community side, and we're hoping to address both angles. And then the whole plan is to have about 25 minutes or so breakout rooms, where people can talk about what is working well, what will they want to see, what will people want to see improved, and so that it's more of a community thing. So I'll now hand over to Dr. Faye Bruce, who is the chair for CAN.
Thanks, Charles. Good evening, everybody, and thank you for joining us on this incredibly hot day. So hopefully everybody's cool and able to, spend that time with us for the next hour and a half as we go through what I see as a really important listening event. So as Charles said, I'm Faye Bruce. I chair the Caribbean and African Health Network. And I must say that sickle cell, and of course with Anthony Mason as one of our kind of co-founders really of CAN, came and really emphasised the importance of sickle cell, given what we know about all the statistics in terms of the numbers of people that are affected by sickle cell within our communities. So it was only right that we had sickle cell as one of our priority areas of basically focus for CAN. So I'm delighted that we've got this listening event, and I must say one of the most important jobs that I do, amongst all of them, is the ability to listen to people. And I do some work with the Patient and Public Voice for maternity services across GMEC, and across the Northwest actually, and that's all about how we listen to people to inform how we move forward in terms of services that people need and people will want to use. So what we often say is that, if the services are provided and people don't want to use them, it makes no economic sense. And what we need to be doing is basing our, our services around the needs of individuals. So it's a really good opportunity that we've got this evening, just to listen to people with those lived experiences, to be able to help us to shape some of the services that I see from where I'm standing has been underinvested for many, many, many years. So I don't want to kind of take up much more time than that really, but just to say thanks for joining. It is a packed hour and a half that we have with you, and we really will take on board, the points that people have made. We will write a report about this, and we will make sure that it's shared across, our communities and our commissioners and providers. So thank you all again, and I hope the session is fruitful. Thank you.
Yeah, thanks for those words, Faye. I think we're going to kick it off. It's all about patients, it's all about experiences. So I'm going to invite Karen Johnson, who will share some experiences. So over to you, Karen.
Hi there, Charles. It's Marcella here. I did send you a message. Sorry, I'm actually driving at the moment. That's why I'm only on audio only. Good evening, everyone. Charles, I sent you a message to say that I'll be speaking on behalf of Karen.
That's fine.
Yeah, okay then. Karen is my niece, and she has had sickle cell from around the age of 12, if I'm not mistaken. She's had it for a very, very long time. And a few weeks back, she experienced a crisis. When she went to MRI, she was accompanied by her sister, and the security at MRI didn't see it as urgent, was asking that Karen take a seat in the waiting area. And despite her sister saying she's having a crisis, she needs to be seen urgently, the security guard, as far as he was concerned, it wasn't urgent and was asking Karen to take a seat in the reception area. And as far as I'm aware, it was only by chance that one of the ladies on reception, on the reception desk, overheard the conversation, recognised that it was a sickle cell crisis, and she jumped into action. Now, the concern for Karen at that point and her sister was that if the receptionist wasn't there, or the person who was sitting behind reception was not there and wasn't aware about sickle cell and the urgency that is required when somebody is having a crisis, what would the outcome have been? There was when that lady jumped into action, they got Karen into a room and started the necessary treatment that she needed. The other thing was that Karen felt that, or her sister felt that it was a little bit frustrating that there was no other support available in terms of as far as she was aware, a helpline or a telephone number to call. And Charles, I got in touch with you, and I think my other niece got in touch with Anthony. But we just thought that there needs to be, in terms of the hospital, there needs to be some education around sickle cell from the security guards at the front of the hospital right up, because had that person hadn't been on the reception desk, who knows what may have happened. And the thing is, for Karen, it's very frustrating that sickle cell isn't being seen as a priority. Is it because of the fact that it only affects Black people? That's why it isn't a priority. And also, there needs to be some kind of 360 degrees support when somebody is going through a crisis, and when they go to hospital. And also, there just needs to be a more joined up approach to support not only the person going through the crisis, but also the family member that's with their loved one whilst they're going through the crisis. So I'm so sorry. Karen sent her apologies. She's not able to be here, but I said I would speak on her behalf. Thank you.
Thanks very much, Marcella, for, eloquently sharing Karen's experiences. I'm now going to bring in Katie, who is the chief exec for the Manchester Local Care Organization. I know we've had a meeting and you've had another meeting as well, but I thought it would be good to get you to say a few words, and then after you, whoever will be representing, the HCC or MFT from the acute side, could also share a few words. So over to you, Katie.
Thanks very much, Charles, and thank you so much for inviting. Oh, I come off mute. Yes, thank you so much for inviting me onto this and for allowing me to be part of the listening event. So I just thought I'd very briefly share where my understanding of this issue is up to, and kind of who I am and what I'm about. But before I do that, I just really wanted to thank Marcella for coming and talking through that story. I've noted down a range of things that Marcella talked about in terms of the kind of awareness of sickle cell into the MRI and into A&E, especially from the security guard perspective, and then more generally how we do that better. And Stuart Moore, who's my colleague from MRI, is also on the call, but between us we will make sure that we feed that back into the hospital through Vanessa Gardner, who is my colleague and the chief exec at that hospital as well. So I wanted to say thank you for bringing that to our attention, and that we will make sure that that feeds in as well. So my name's Katie, and I have worked in the NHS and the healthcare system for a little while, and for the last 4 years or so I've been working as part of Manchester Local Care Organisation. So we run the community services, and we've got some really valued colleagues from the services on as well this evening to listen to some of the event. And many thanks to Helen and Werner for being on as well. I think that's really, really welcome from my perspective. When my kind of real involvement with this, so, you know, this is both an apology and just being really transparent with you. My first involvement with this was a kind of couple of weeks ago, when Charles and Ngozi, who's also part of this network, had spoken to Peter Blythen about some of the discussions we were having with our staff, very kind of early discussions about movement of some of the community services out of Denmark Road into a different premises. And as I was listening to the feedback from Charles and Ngozi, I realised quite quickly that, yes, there is an accommodation issue that we are dealing with as a community service, largely due to some of the COVID changes and our staff being displaced into different areas. But I think we quickly agreed that we just needed to stop the conversation about movement, because actually what Charles and Ngozi talked about was a little bit, as Marcella said, the sense and the feeling that from the perspective of you as people who use this service, whose families use the service and who use this service, that actually it was really felt that from a community care perspective and potentially from an MFT perspective, we didn't care about you as a client group, and we didn't give due care and attention to the needs that you had and the investment that should have gone and must go into this service. And Charles had already taken the decision to have this listening event, and so I just really welcome the opportunity to come and listen. The way that I intend to work with you is that I do want to use what you talk about tonight to start to build some improvements in what we're doing. I've met with Peter Blythen, who is the kind of one of the group directors at MFT, and Stuart was representing Vanessa, and also somebody who does the kind of bigger strategy work within the trust, because my main focus is around community and social care. And together we've absolutely agreed that we need to look at this and really use the learning that comes out of this event and some of the feedback that I know you're going to give us to try and take this in a more positive direction and take the next step. And, you know, I need to support how we join what we've got in community into the overarching work that MFT does, and to try and get this into a place where actually it's a service not only that meets your needs, but hopefully exceeds them, and also begins to think about that broader role that Charles and Ngozi reminded me of as we were talking about the fact that this centre isn't just a centre for Manchester, it is a bigger centre, and we need to be thinking in a much more ambitious way about how we support this community of people who need a service across a bigger footprint as well. So I'll stop there, and I'm not going to have answers tonight, and I'm sorry about that, because it's just where I am in my learning about this. But my genuine commitment to you all is that I will listen and I will take it away, and we will work together to improve what we've got.
Thanks very much, Katie, for those words. And I know right from the initial conversation, you have made a commitment to be transparent, to learn, to listen, and to work with the community. And for us, the co-production is what we've been waiting for. So thanks for that. I wondered whether Stuart, on behalf of MRI or MFT, you want to say a few words?
Yes, thanks for the opportunity, Charles. Yes, I'm Stuart Moore. I'm Director of Strategy for Manchester Royal Infirmary, and I've had some little involvement with the service within the hospital as I helped the team within haematology to put together the bid for the HCC, for the Haemoglobinopathy Coordinating Centre a couple of years ago. And what was clear from that is how important this service is for people in Manchester and the community and beyond Manchester. And it really does give us a great role, a great opportunity for showing what we can do in Manchester and in Greater Manchester for people with these conditions. I think I saw from the original agenda that you'd invited Mary Aziz, who's the network manager for the HCC, to come along, who we've been in touch with her, and unfortunately she's on leave because of Eid this week. Hopefully that message did get back to you. And I'm afraid as well, other apologies I bring from Dr. John Granger. A number of you will perhaps know John. He's a consultant paediatric haematologist in the Children's Hospital, and he's going to be taking over as the clinical lead for sickle cell across MRI and the children. So we'll have a single hospital clinical lead to work with the community and the services, taking over from Kate Ryan when she retires next month. So I'd really just like to reiterate what Katie said about the fact that I think we're really pleased that that you brought this really to our attention. That's what we want to be able to be. We want to be able to hear if people are experiencing issues, and as Katie touched on, we from the conversation that she and I and Peter Blythen had earlier this week, we're really anxious that we can get on and really look at how we can provide, I suppose, the right service for people across the hospital and the community, and make sure we've got those relationships right so that people do get the right care, and that the people that they're coming into contact within our services do understand their needs. And so I'm really grateful that to have the opportunity to come along and listen this evening, because we have to start with what people need, how people experience the services for good or less good, so that we can really understand how we can improve the services. But also, particularly, it's great to have the opportunity to start just strengthen some of the relationships, so that as we're doing that kind of work, we can make sure that that's something that we are doing with the people who are using the services, and the people and their loved ones and carers, and with a wider community, so that we can be developing that with people, and not just kind of for you. So thank you for the opportunity to come along and listen this evening.
Thanks for that, Stuart. And also, maybe I should have mentioned my, the conflict of interest. So I'm one of the nominated governors for Manchester Foundation Trust. So worth putting that on record. So, this conversation and hopefully the commitment and, the genuineness, we will make sure we see that through, because, we flagged it up at Council of Governors meeting as well. So there is real support. And I know, there have been previous conversations, but I think we are on a new path and a new journey. So, watch this space. I'm going to bring in Reverend Anthony Mason. As Faye mentioned, Anthony was one of our co-founders for CAN, and therefore sickle cell is always featured, as one of our priorities. So over to you, Reverend Anthony.
Good evening all, and thank you for the afforded opportunity and the platform that's been set forth for us to be able to, at first, let's say, address some of the concerns, and let's see as to what basically is going to manifest into progress and actually action points that actually will be taking place from this. Just a bit of backdrop into myself. I'm co-founder and CEO of Sickle Cell Care Manchester. We support group set up in 2011, became a registered charity in 2015. And basically what we've been doing over the years, let's go a bit before that. I was also the regional care advisor for Sickle Cell Society in 2004 to 2009. I was actually based working at the Sickle Cell and Thalassemia Centre. Part of my remit covered both Manchester and Liverpool. That was a massive undertaking, but it got great traction in terms of our community working relationship and building some level of community aspect that was a bit deficient, I must say, in terms of the statutory body really having the ear of the community. So also I'm a patient in a person living with the condition, approaching the age of 52. So going beyond what's out in the public domain at this moment in time, that states with sickle cell, the male living up to 42 and female 48, which again, that needs is something that we need to address, something that needs to be taken on board. That's what's put out in the public domain for people when they're looking at sickle cell, and this needs to be addressed. Now, I could go into a plethora of issues, and I thank Marcella for really just giving an icing top explanation of what happened in terms of her cousin. I have known Karen for many years, and I did receive a call, as she alluded to, from Karen's sister, and she was very, very disappointed in terms of the experiences that she had been faced with at the Manchester Royal Infirmary. One of the issues that she mentioned and she thought would be in place was a person would be a community liaison officer, someone who wore the hat of working in the community, but also had access within the system, the statutory body. Now, just before I go on, I'm not going to be too long, but just to capitalize on this area, the MRI have a system, and this was something because I also, as part of the Sickle Cell Society, we helped to write the adult standards, which was worldwide renowned as being one of the best standards and templated. Myself and Bernard Davis, who's on board here, was part of that initiative. And it's something that we refer to quite often, being changed, it's been revitalized and revamped. The point I'm making here is that in that report, it states that within half an hour of somebody turning up, living with sickle cell, that they should actually have analgesia, some pain relief, and supposed to be treated. Now, the problem that we have, and we have had over a period of time, is that this is not being adhered to, because what was happening, people going into the hospital, they were getting put into a side room, and it was being ticked off to say that they were being addressed. And they would spend many hours at times not actually being addressed in terms of having the pain relief. This is something that needs to be looked at. Another issue that we have is that there's no training within the system in the medical profession, whereby you have nurses and doctors who actually understand sickle cell. So when they go into the aspects on the front line, they're asking questions that are quite irrelevant in terms of that person being in crisis. And therefore that's adding to the aspect of the person going through crisis. And also it's adding to the fact that you as a statutory body have to expunge the aspect that that person could remain in hospital for a longer period of time because they've not been addressed a lot longer. So we're talking about a cost initiative here that needs to be addressed. Again, this will bear out in further conversations. I'm skating across certain issues that need to be addressed in terms of this. However, we also need to have a cohesive support mechanism that addresses not just the aspects of when the person goes into hospital, but how they're addressed in the community. How do you sustain somebody who spends 90% of their time in the community? If you can start to address those type of issues, maybe we'll see a reduction in terms of hospital days and hospital readmissions in that support mechanisms. So there's a cost aspect that needs to be addressed. I could outline a few of them as suggestions and solutions. I won't do at this moment in time because this needs further drilling down, and I'm happy to meet with other individuals, and I've had correspondence with individuals who I've been meeting with, and believe Katie, you'll be one in the future as well. Stuart, you're a bit new to myself in terms of being in the arena, but my eyes really on the factor of looking at it and their fingers on the pulse. And I like this approach rather than the top-down approach that we've had in the past, whereby, people at senior levels says, this is what we'll feed to the public and see if they'll have it. I prefer the sandwich approach, that you meet with the community, find out what's happening at ground level, see what you can do at top level, and we have something palatable in the between as a sandwich that is palatable for everybody along the line. And this is going to take a while. Let's not look at this as a speedboat aspect. It's more like turning a freight liner, which is going to take a while, and we have to be realistic and take the pragmatic approach in that. Now, in coming to a close, there are some issues that need to be addressed in terms of some aspects of communication. There's aspects in terms of the working partnerships with the Sickle Cell and Thalassemia Centre. There's aspects in terms of how resource the community aspects in terms of sickle cell care, for example, as being the only registered charity that's addressing sickle cell needs, having a working relationship for many years with the MFT, with Kate, as you mentioned. There's a bit of a disappointment with Mr. Grange, and I'd like for him to be here to have defended that, because myself and my colleague who's on board here, Chantal, we met with John in terms of trying to roll out some of the community initiatives, and that didn't really go too well. So again, I'm not holding my breath in terms of that area. I need to see some progress, and I need to be frank, because I'm here in terms of a legacy. I'm here in terms of what happens to individuals or myself. If I go into the hospital, how do we address these concerns, and how do we make sure that we have a working aspect? And then finally, even though there's been a lot of promises made, we had the devolution that came into Manchester 2017, and where there was great promises were made, and we at Sickle Cell came around the table expecting sickle cell to be one of the conditions that was to be on this platform. That wasn't mentioned, which was a massive shame. In terms of sickle cell didn't actually feature, and somebody mentioned in terms of what Marcella mentioned, is it because it's something that is affecting predominantly the Black community? Let's be frank, we have to take the elephant out of the room if we're going to make any progress. I think the George Floyd has really unearthed a lot of things whereby there is issues across the board that are institutional that need to be addressed. And also, on the last point is this: there needs to be equity in terms of funding. Cystic fibrosis, a paper that came out from Dame Elizabeth Aniunu, and pronounce her name properly, Aniunu, who basically is emeritus professor from Sickle Cell Society, who showed a stark difference in terms of funding for cystic fibrosis as opposed to sickle cell. Yet the number of sickle cell individuals in the UK far exceeds cystic fibrosis, and I must say that the NHS are responsible for that. In terms of that paper exists, and also in terms of looking at thalassemia that we need to look into in terms of some of the equity that needs to be brought. But again, my here is not to make a moaning aspect. I'm here to make sure that we make some progress, some tangible progress for not just those that are living with the condition, but those that are affected by the condition, whether they're carers or those or parents that are looking after individuals with the condition. So I think at that point, I'll hand back over to Charles, and obviously we can take things further.
Reverend Anthony, thanks a lot, and fully take on board all you've said as someone who has been advocating, championing this for many, many years. So thanks for that. I'm going to bring in, before we go into our breakout rooms, I'm going to bring in Elizabeth, who will also, share a few words and some reflections before we get into the breakout rooms. So Elizabeth, over to you.
Yeah, hi, good evening, everyone, and I'm happy to be here. Before I start with my story, I've got a question for Kathy, really. I want to know, how did the decision came about to relocate the Sickle Cell and Thalassemia Center itself? Because for me, what I've read, according to the NHS policy on service delivery, to do that, there are a few things, criteria that need to be fulfilled, and none of them were fulfilled. One, in terms of patient engagement. Two, in terms of equality impact assessment. All these things, I can go on. I don't want to, because we're here because of it as well. So I would like to know how that decision came about. I want to understand that in terms of how the decision came about to relocate the center without no conversation with patients or anything? If you can answer me that question before
Of course I can.
Yeah.
Of course I can. Thank you. So I think the first thing to say is that that decision hasn't happened and didn't get made. So the discussions started with the need to move a range of different community services across Manchester due to some of the COVID pressures of accommodation on the MRI site. And I think as soon as we became aware that there was an issue being raised through our services and through Charles, that actually this was going to be a major issue, we've said, right, okay, from our perspective, or from the people that have been involved in this, what we were trying to do was to find better in our heads premises, clinic premises, for people to be able to access, and also to accommodate some more people in the space. I think as we listened to Charles, which we did, and Ngozi talk, it became really clear that this building was much more than just a clinic space for the community. And so we took the decision that actually we needed to come and talk with yourselves and with broader people in the community before we did anything. We weren't at a formal stage at all. We were in the kind of exploring options stage. And so I think we've kind of stopped that absolutely in good faith to have this conversation. And I think what became clear, certainly to me, was that if you look at it from a pure accommodation point of view, you get potentially one solution, but that solution did not seem to be acceptable or in the spirit of the conversation we're having today. So I can only say that's how it happened, came to my attention, and then the action that we've taken. I don't know if that helps.
Yeah, thank you for that, because I am a patient of sickle cell disease. Also, I'm a staff member of MFT Trust Oxford Road. So sometimes I've been in work and sometimes my crisis hasn't been serious. My colleagues have taken me sometimes to A&E to be treated, and sometimes I could manage it, but I can go to the sickle cell center and they've called me taxis to take me home. So for me, working at MFT as a patient is very, very important for me to have that center. And that center has been a vital place for me to be able to work at where I am. So for me personally, I have a passion to keep the center where it is at the moment. Okay, about my story. Thank you so much, Kathy, for that. As I said, I'm a sickle cell patient. I've had good experience and bad experience going to hospital. During the COVID last year, I was in there. I was looked after really, really well. But then I had to ask for things, because normally when I'm in the hospital, I don't say to people, oh, I work, I'm a staff member, because I want them to treat me as anybody else, as any other sickle cell patient that come into the hospital. So when I went into the hospital, yeah, the security guards were there. So because I was waiting for ambulance, but ambulance was taking too long, so I just called a taxi, took me to A&E. So when I got there, the security guard asked me, why are you here? And I said, sickle cell. He could see in my eyes I was crying because I was so much in pain. So then he went inside, got someone, came, and then they took me through a different corridor and took me to a different ward. And then they looked after me because they said to me, this is what we've got a space to treat people with. I told them I'm shielding. I let them know I'm shielding. So I need to be protected, to put me in a side ward or something, because I can't be among other patients, because I don't know if the other patients have got COVID or not. So I asked for all these things. I know in pain, when the pain was a little bit manageable, I was able to ask for these things, because I said to myself, one thing I've realized, living with sickle cell since I've known having sickle cell since I was a child, primary school, yeah. My parents, they told me at a very early age what was happening to me. So, yeah, I asked them everything. I got treated well. They put me on the side ward. And then after I was better, they discharged me and I came home. For me personally, the question I want to ask, I want all the sickle cell patients to ask themselves, what is your ideal service? What is our ideal service? That is the question we need to ask ourselves. Also, as a patient, I've been involved bringing in social social enterprise people to provide services freely for sickle cell patients. For example, coaching, we've done it. I know some of the patients have said to me that were involved, that they really enjoyed it. They wish it can continue. And they can see a lot of improvement in their lives and things, because we talked about so many things. We had workshops in terms of, if you're working, what are your rights as a sickle cell patient, things you need to ask for. And that's what, being on that workshop as well, I've managed to ask those things in my department. Also, how to take care of yourselves, how to eat well, and all these policies that you need to know. So it was quite informative. I've been involved in the transition workshops as well to our younger patients who are coming on the outdoor services, and I tell them about my experiences of living with sickle cell disease. I've had a chance to live in 3 countries personally: Ghana, Spain, here. And everywhere I've had different treatment of sickle cell disease. When I was back in Spain, the hematologists, they never had a sickle cell patient. But the treatment that I got was totally different from here, because it was more inclusive of holistic in terms of food and things that you need to do as a patient. And I thought they were the ones that started me on healthy eating and healthy exercise and all these things to keep me going. And I can see how it has had a profound effect on my life, my working life, my personal life, and everything. Also, we've done some Stay Positive programs for patients, and I hope we can do more things for patients. Some of the services, my experience again in hospital, I've said sometimes it's been good, sometimes it's been bad. MRI, good. Sometimes ambulances can get me to MRI. I live in Ratcliffe, so sometimes they take me to Fairfield. And when I'm there, nobody knows what to do with me. I've had a consultant, cardiologist, come to me and A&E. What can I do for you? Because I do not know. I've never treated any sickle cell patient. In some way, I do understand him because, okay, my profession is in medical education. We train medical students to become doctors. And part of our curriculum, we do not teach our medical students sickle cell or thalassemia. For them to know about sickle cell and thalassemia, they have to decide as a student, have interest to do it as a project. So first and foremost, we graduating students, because I've been in A&E and I've seen some of our medical students on there, and they're like, oh, what can I do? They shocked, basically, seeing me there. And they didn't know what to do with me, because first and foremost, they've not been taught about sickle cell and thalassemia. I've mentioned this before. I think we need to speak to the General Medical Council about including sickle cell and thalassemia in the curriculum to help, because that's how we're going to move forward with sickle cell patients. Without that, because we follow Manchester Medical School, we follow the GMC curriculum and what they say. So if they're not included in it, we're not never going to teach our medical students. We're still going to graduate doctors that wouldn't have still idea about how to treat a sickle cell and thalassemia patient. So because I want, when I go to Equity, as Anthony mentioned before, I want when I go to Fairfield or I go to North Manchester or I go to MRI, I want to have the same service. I want to be treated the same as a patient. I do not want, whilst I'm in pain, serious pain, a doctor coming to me and saying to me, I do not know what to do with you because I've never treated a sickle cell patient before. So for me, I think it's really, really important that we look at the good is there. We need to look at the bad in there as patient, and we need to ask ourselves, what do we want as a patient? What can NHS service delivery give us? Because I sometimes feel that we are sometimes treated as second-class citizens, because I said, I've got sickle cell, but I still work, pay my taxes. And sometimes I get annoyed about it. So I should be treated like any other patient that goes through A&E, but sometimes that doesn't happen. So for me personally, I think we need to, one, this relocation of this sickle cell center needs to stop. I do not want to hear in 5-10 years time again we having this conversation about it.
Elizabeth, can I stop you there? I'm going to put us into breakout rooms.
Okay.
We're going to have 3 rooms, and then various people have had reflections from yourself, from Reverend Anthony, from Marcella on behalf of Karen, and I've got colleagues on the call we've got 4 questions in the chat box. You're right. Yeah. There are things that are working well. There are things that needs improving, and maybe within your group as well, some of the thoughts and ideas you have, you can feed that in, and then we can have other people sharing experiences as well. So Elizabeth, if you can do the magic and get us into 3 rooms,